Hello, everyone. It's Dr. Nirav Pandya. San Francisco 49ers fans just found that Elijah Mitchell will be out for potentially 8 weeks with an MCL injury. Here's a quick breakdown of the injury and what we potentially can expect for a return to play timeline. Now, the first thing to understand is that it was reported as an MCL sprain. As we discussed before, a sprain is actually a tearing of the ligament. A grade 1 sprain is basically a microscopic tear of the ligament. A grade 2 sprain is basically a partial tear of the ligament. And a grade 3 sprain is a complete tear of the ligament. Now, based on the 8-week timeline that was reported in the media, this potentially could be a severe partial tear or a complete tear. Now, here's a quick breakdown of what the MCL actually does. So the MCL is located on the inside part of the knee. It's an extra-articular ligament, meaning that it's outside of the knee joint. What this ligament basically does is prevent the knee from basically having instability in this plane. Now, the most common way the MCL is actually torn is when there's a blow to the outside part of the knee, which is what it appears happened to Elijah Mitchell during the Bears game yesterday. Now, in terms of the actual treatment of these injuries, it's important to note that because the MCL has good blood supply and it's located outside of the joint, it has a very high propensity to heal without knee surgery. Now, there's certain times when the MCL will need surgery is when it's associated with other ligament injuries. So if you tear your ACL, or one of the things you notice is that the meniscus is located right here as well too. So sometimes if associated meniscus tears with an MCL, the MCL may require surgery. In addition, in rare cases where the MCL actually pulls off the bone, particularly on the shin bone side, sometimes that will require surgery as well too. But the vast majority of these injuries, they don't require any surgical intervention. It can heal with rest, bracing, and physical therapy. Now, for grade 1 injuries, which are microscopic tears, these typically will heal in 7 to 10 days. For grade 2 injuries, which are basically partial tears, sometimes that'll take 4 to 6 weeks. When you get to grade 3 injuries, sometimes that can take 6 to 8 weeks or even longer, which sounds like potentially maybe the case with Elijah Mitchell. But even in these severe injuries, barring the fact that there's not any other ligament injury in the knee and that this ligament actually hasn't pulled off the bone, these will typically heal with rest and bracing, and then physical therapy and basically modalities such as icing and getting into exercises such as range of motion and strengthening to basically get that knee stable. The good news is that for isolated MCL tears, there's a very high return to play rate, and there's a very high possibility, barring the fact that there's not any other injuries or setbacks, that Elijah Mitchell could potentially come back in the latter half of the season and contribute to the 49ers from the running back position. Thank you.